Welcome everyone, welcome to Virtual Voices. I'm Elizabeth Pruch. I have the pleasure of overseeing our alumni engagement and advancement work at the Leadership Foundation. Virtual Voices was a series we created to ensure we could keep our alumni engaged and informed during the recent pandemics that have hit. And we've really been able to grow this conversation to touch a lot of very important topics that our community is facing. I want to start by just giving you a few reminders for the Zoom calls. If we could switch the slide over, we'll show you some Zoom reminders here shortly here. Nikki, are you on, my friend, to switch it? Thank you. So our Zoom reminders, we're all very familiar with Zoom, of course, by now, but I do want to just bring attention to speaker view. We would suggest that just so you see who's talking, but also want to make sure the chat feature, you are welcome to use that as you see fit. This is where we'll really talk through any questions you might have. You can enter them into the chat box and I will call on you if you have a question. I love it. George is already on it saying good morning to everyone. As we get started, I would love to ask you guys as I start reading bios, but I'd first love to ask, as we're doing intros, to type in the chat feature for us why you decided to join the call today. Why is mental health important? Why are you here today? Just start getting that chat feature flowing while we do a few more welcome remarks. Next up, Nikki Barta is on the call. She's going to manage this for us from a technical perspective. So if you have any questions technically, you can find her in the chat feature and reach out to her. I'd love to thank our sponsors. We all know how important sponsors are to what we do. Molson Coors Beverage Company, Southwest Airlines, and TIAA have been truly wonderful thought partners and supporters of the work we do at the Leadership Foundation, and specifically with the work we're doing with our alumni to ensure we get to continue to engage our alumni in really meaningful ways. So thank you to our sponsors. We really, really appreciate them. Now I get to introduce our speakers for the day. Again, please add in that chat box why you're here today so that we have a better understanding of what you want to accomplish from this call. But allow me to introduce our three speakers. I want to thank Kelly, Justin, and Lorez so much for being here today. And I'll start by just giving a short bio on each of them. Kelly Duncan joined Community First Foundation as president and CEO in 2019. Previously, she worked for a variety of nonprofit businesses and social impact organizations. This includes 11 years at the Colorado Health Foundation in Denver. She also served as a consultant for businesses, nonprofits, and social impact startups, as well as projects in Lima, Peru, where she developed her Spanish language skills. I need to practice with you, Kelly. It's been a long time since I've been fluent. Welcome and thank you, Kelly. Appreciate having you here. Next is Justin Kruger. He is just a tremendous man, founder and CEO of Project Helping, which you'll learn more about here soon. It's a Denver-based mental wellness organization. He grew up in a ridiculously small town in Iowa, studied finance and economics, which he now, of course, doesn't use at all. I couldn't even pass the classes in college, so good for you for studying that. He instead decided to play golf professionally before starting a career in the golf industry, where he spent over 15 years doing all the jobs you could possibly find in the industry, most notably staying with Ping Golf for almost 10 years. His personal struggles with mental wellness led him to leave the golf business and start Project Helping, which is all about providing purpose, connection, and mental wellness through kindfulness. And you'll learn a lot more about what he does and just the impact it's made on him and others in this community. Finally, Lorez Menhold, we are so thrilled to have you here. Lorez serves as the Executive Director of Caring for Denver Foundation. She brings over 19 years of implementation and policy experience as a director for multilateral initiatives involving the public, private, and civic sectors, working at the local, state, and national levels. She's worked in many capacities integrating health programs, addressing mental health and substance misuse needs, connecting early childhood and health communities, delivery and payment system reforms, and efforts that require statewide stakeholder engagement. We are really thrilled to have these three leaders with us here today. And I will say also that, you know, you may notice that we don't have a speaker here today at Virtual Voices that works specifically in the mental health industry. And that's intentional. We wanted to provide you with some leaders that could really provide a broader look and resources and connections and offer us ways that we can help. In addition, the folks, our connections and our friends in the mental health industry are very busy right now. They've got some priorities that they need to focus on, and we respect and appreciate that. So Thank you again to Justin, Kelly, and Lorez. We really appreciate y'all being here. I'm going to start us off, and thank you in the chat feature. I encourage everyone to read what's happening in that chat feature. I will get to those questions and thoughts at some point throughout this, but I want to start with Justin. Justin, could you tell us more about Project Helping and your story of why you started that?
I almost forgot to unmute. Yeah, I'm happy to. So I think I started Project Helping based solely on my own personal experience. So I am not a mental health practitioner by trade. I did not have a background in that space. But I did grow up, as you alluded to in my bio, in a ridiculously small town in Iowa. It was about 900 people. So that qualifies, I think, as ridiculously small. I started struggling with my own mental health when I was in kind of late middle school or early high school, as I look back. And believe it or not, 25 years ago, and in a town of 900 people, there were not a lot of mental health conversations being had and not a lot of mental health resources. But I looked at the people around me that I thought looked happy, that they had it all together, and I wanted to aspire to be like them. And it was people that were successful professionally, had a good job, and sort of outwardly you could tell that they were successful. And so I believed that if I was successful professionally, that would make me happy. And so I went down that path, studying finance and economics. And oddly enough, growing up in a small town in Iowa, I was also really passionate about golf. And that's how I got into my first job, if you will, which was actually playing golf for a living. My parents would say that doesn't qualify because I didn't make any money. So it's not really a job. But that was kind of how I got into the golf business. And I was really quickly successful working for Ping, and professionally had everything you would kind of think of when you think of success. But what people didn't know is I was struggling really intensely alongside that professional success. So at 24, I was hospitalized for the first time for my mental health, so admitted to the ER. And I remember being so sort of ashamed of being there, that I didn't tell anyone. No one knew that that's why I was in the hospital. And so I also didn't follow up on any of the suggested, therapy or medication or resources that were given to me through the ER. And that's a really good way to land yourself right back there, which I did about a year later. So twice in about a year, I was hospitalized. And really all I took from it at that point in my life was that I never wanted to go back to the ER. So I continued to work really hard to be successful professionally, struggling pretty intensely personally. So I got transferred to Denver. This was about 12 years ago. And I was in such a bad place with my mental health that I actually had put together a plan to commit suicide, because I felt like the only real out at that point. And so ironically, about that same time, I started dating someone, because that felt like a healthy time to start a new relationship, I guess. So I started dating someone, and she invited me to volunteer. It was like our third date, and I'd never done it. I'd never given back. I was only focused on how successful I could be professionally. So I went just purely to try and impress said girl. And, it must have worked, because one, she is now my wife. So that part worked out really well. But I remember going to volunteer and being so moved by the fact that I was going to be doing something that day for the first time in my life that I could remember, that was focused on someone else and not about how much money I could make. So I started to volunteer all the time, as much as I could. And I started using that as sort of a self therapy, if you will. And so I grew equally frustrated with how hard it was to sometimes sign up and find volunteer opportunities. So the fact that volunteerism became this really powerful mental health resource for me, and my frustration with how hard it was kind of the culmination of experiences that led to starting Project Helping. So our mission is really simple. We try to make it ridiculously easy for people to find ways to give back, so that they can use it as a tool to build purpose and connection, which in turn improves mental well-being. And so I started it just based solely on my personal experience, and we've been around for almost 10 years now.
And we can vouch for the wonderful work you're doing. Justin and his organization have helped our Impact Denver class for many years in providing these kindful kits and the kindness kits, and they're just tremendous. And thank you, Justin, for sharing your story, being so vulnerable. it's important. And what we're seeing in the comment section just alludes to that. You know, it's a lot of conversations about this conversation is so taboo, and mental health, talking about it is so taboo. And we're going to talk a lot about the stigma of that here today. And on that note, I want to move over to Lorez. And Lorez, Caring for Denver has several focus areas, but I'm wondering if you can expand on the community-centered solutions side of it. What are community-centered solutions as it relates to mental health? And maybe give us a little background on Caring for Denver Foundation as well, please.
Sure, great. Thank you. Thank you for the opportunity. Always love sharing a little more about the foundation, as it was founded and funded through voter support. So we were a ballot initiative in the city and county of Denver in November of 2018, and it passed with 70% of the vote. 70% of people recognizing that people weren't getting the care supports they really needed in a way that was really helping them on a path to recovery, whatever that path to recovery might look like. So our charge is to address mental health and substance misuse challenges facing the residents of city and county of Denver. And we have always had community at the heart of what we do, in that we are the community's dollars. And so we really look to support community-informed solutions, dismantle stigma, because again, that's come up a lot in the chat box, and Justin talked about it. I mean, it shows up everywhere when you're talking about mental health, and as you're, you know, also talking about substance misuse. And you'll see, I will not say substance abuse. We have changed our language, and we're trying to change the way people talk about it. Is that abuse leads people, as we talk about stigma, you know, the more we talk about issues in that way, the less inviting it is to partake in sort of solutions or supports that you need that might be traditional or non-traditional. So we hope to dismantle stigma and turn really communities' desire to help into action. So one of our first charges as Caring for Denver was to engage community to say, well, what should we fund? So we had one defined area of alternatives to jail, but the other three were really meant to be defined by community. So over a 6-week period, we met with and connected in sort of Denver community to gather perspective and insights on what people wanted us to fund and what these priorities should be. So we did outreach events, both in person, over the phone, online, English, Spanish, and engaged 1,600 Denver residents to say, what is it that you want us to fund and why? And then those really became our 4 funding areas. So it's alternatives to jail. It is youth, 0 to 26. How do we support youth, build more resilience? It is care provision. How do we make more culturally appropriate care? How do we support caregivers? How do we navigate what can sometimes be a complex system? And then the 4th area is community-centered solutions. And it's just that. People feel like just sometimes the system of care in itself is a barrier to care. And so why can't we have more solutions at the community level, really focused on, directed at innovative mental health and substance misuse supports, which really prioritize access, cultural relevance, collaboration with community, and really help address the stigma that discourages those in need from seeking the support they need. So again, the supports that might be needed in the Latino community are different than maybe what's in the Black community, different, what might be tribal communities, different for women, men, veterans. You know, we can go through all populations, but no one person is just one thing. We are an intersectionality of many. And so we've also let people define, what does community look like to them? It's not always a place, it's not always a population, it's how people come together. And so our focus on community-centered is really supports available in community at times and days that work best for community. Supports in places where people live, know, visit, learn, trust, pray. Art as a tool. So I should say, even as we were getting started, the art community was one of our biggest supporters in passing Caring for Denver, just given the high substance use, mental health, suicide needs within the artistic community. But art can be used as a tool to really promote and encourage recovery and wellness. And art is whatever you can imagine it to be. So again, it doesn't mean one thing there. And we really sort of recognize there's many sizes to get people to the right care and the recovery. We know the importance of peer support. So that's people with lived experience helping people navigate and support people in this recovery, because it's never linear. There's always challenges, and sort of having somebody that has experienced that, done that, is sort of really important. And then for us, it also means, how do we have more messages developed and spread by community in their own voice to talk about mental health and substance misuse, so that we have, it's really words that resonate and reflect. So even as we did that 1,600 and figured out the funding areas, and then as well, you know, why that was important, we then talked to another 40 people before we released this call for proposal to ask them why community-centered work is important. What does success look like? Why is language important? And really, you know, we heard things, community members will be more comfortable if the care is in their community. There's an opportunity for supports to show up in places where they feel comfortable. People typically recover in community. Rarely do they recover in isolation. People feel comfortable in settings that they are familiar with, not stigmatized locations. And then art as it opens doors and provides outlooks for folks struggling with mental health and substance misuse. Success would look like, how do we, you know, change in how community views people's experiences struggling with mental health and substance misuse. More accepting and understanding of those circumstances, people supporting one another, messaging with language tailored by community, building trust within communities. Language is important because we need better common language to discuss mental health substance misuse. We need to be more comfortable talking about this. More people comfortable discussing mental health and substance misuse issues with language that isn't as stigmatizing, and move us away as taboo subjects, which came up a few times in the chat about how mental health and substance misuse is taboo, and how do we undo the taboo-ness. But really, this is about appreciating and centering based on community's experience. Communities are the experts. They know what works in their places and spaces, and too often we try to create for rather than them creating the programs that are going to work best for them. And so really we're about honoring community in this work. So that's, I mean, a little bit of both what we learned and heard. We just closed our community-centered funding cycle. So on Friday, we received 96 proposals for $28 million. We have a little less than that to give away, but what's really exciting are all the ideas and thoughts about how community can come together to really have an impact on mental health and substance misuse in a way that resonates with them and honors their wisdom, their knowledge, and their community.
Thank you, Lorez, for that in-depth overview. I think what's so important about what you're saying, number one, that the need is so great, and that's very clear by the number of proposals you got in, but also that you're working with the community. I think it's those systemic, not systemic barriers, but the systems in place that, like you said, we're creating for instead of with, and you're taking that step to create with the community, and that should have greater results. So kudos to you guys, really appreciate that. Kelly, hello. We're very happy to have you on here. Kelly's also a board member of the Leadership Foundation, and we're very excited about that addition to our board. Kelly, I want to ask you, at Community First Foundation, you guys focus, again, on a lot of areas, but one that we've talked about previously is how you're helping to reduce the stigma. This is very clearly something that this audience wants to talk about as well. So if you could just dive a little bit deeper into what you guys are doing to reduce the stigma and why that's so important.
Yeah, thank you, and thanks for having me. I to get to talk with and Lorez. So as Elizabeth indicated, Community First Foundation is a community foundation in Jeffco, and our mission right now is to connect donors and nonprofits to power the community toward positive change. And one of our strategies has been to promote mental wellness. And we specifically say mental wellness because sometimes when you say reduce stigma, you sort of made stigma bigger than it even needs to be. But when we're promoting mental wellness, it really is about reducing the stigma, the taboos, the barriers that we all have to either recognizing mental illness in ourselves and others, or just seeking care for mental health issues when they arise. So one of the things that has been really fascinating for me and really troubling is, unlike any other disease, mental illness is typically defined by its impact on our ability to engage socially. So I'm just going to ask you to take a moment and think about that. It's defined by how we can engage socially. And we as humans are born social. We are social creatures, and we're born to interact and build relationships. And yet a mental illness can really hamper our ability to do that. So as a community foundation, we also firmly believe that community is built on strong connections with one another. And like Lorez said, it can be a geographic community, it can be a community of common interests, a community of faith, but it's built on those connections with one another. And so that's why we care about reducing the stigma and promoting mental wellness is because we want to be sure that everyone can be a part of the community and can feel like they are a part of the community. And so while as a society, I really think we have made tremendous strides around normalizing mental health, mental illness, unfortunately, I think there's still significant stigma. And one example I think about all the time is when you have a terribly violent act, people typically revert to saying the perpetrator was mentally ill. That's not always the case. And if you look at the data, people with mental illness are more likely to be victims of violence than they are to perpetrate violence. So I think that's just one indication. The other indication is we use words like crazy and insane to describe people, activities, and situations that we don't really like. And these are those subtle and reinforcing messages that being mentally ill is being othered, and it's not like any other illness that we may suffer from. So we started a program called the Innovator Society, and the goal was really to accelerate and amplify promising but unproven strategies and programs to promote mental wellness. Those like Project Helping, Justin, I'm very proud to say, was one of our first innovators. And we are now in 3.0 of the Innovator Society. And so like many of you, we had big plans for 3.0. We knew exactly how this was going to go. And then COVID hit. And so like all of you, we sort of had to sit back and say, okay, what are we going to do now? And so what we did is we put out a survey and said, what are people struggling with around mental health and their mental wellness right now? And we got responses, and everyone who responded became part of our Innovator Society 3.0. And the challenge question that came out of the survey responses and the work that they were doing was, how do we solve what makes isolated living easier? So we know with COVID, many people have been isolated. Some people have lost their social support. Some people have lost their jobs. People are not able to connect in the way that they were able to connect before. So we're really working with 9 innovators to figure out how we can make isolated living easier for all of us. So that's the work we're doing. It's probably maybe halfway through. I don't have any answers yet. I bet Justin could give you more insight that I could give you at this moment. But we're really excited to see what comes out of this and what sorts of solutions may emerge that can be really helpful to any of us who are struggling with anxiety, depression, or just feeling really isolated during this pandemic.
That really is tremendous work, and it's something that I think we can all take back and look at and use. So we will be staying in touch with that, and we'll send a recap of this call out afterwards, and we'll make sure we include some of these resources and links so we can all learn a little bit more about that. Thank you, Kelly. I want to encourage the audience as well to throw any questions you might have in the chat box. I will call on you if you have them, and you're welcome to ask those out loud, or I can ask them on your behalf. I will start with a question to our speakers as well. And this is, I think, an important question just so that we kind of all understand where we're coming from here. But I want to ask the 3 of you, what does mental health mean to you? Justin unmuted first, so the mic is yours, my friend.
Oh, I didn't know that was like a race.
Yes, you win.
We often talk about this internally and try to parallel it with physical wellness, because I think it's something people understand well. And so our belief and our goal is that every single person has an opportunity to work on and improve their mental well-being every day. And so we look at it as something that we all have. We all have mental wellness. Where we are on that continuum depends on our experiences and a lot of other factors, right? But our goal is to position that as something that we should all be thinking about and working on, just like we should all be going to the gym and eating well and, you know, doing mindfulness and the things that take care of our physical and mental well-being. I think we try really hard to position it as something that we should all be working on and thinking about and talking about every day. As difficult a goal as that is, for us, it's something that we need to make inclusive, regardless of where you fall on that sort of mental wellness continuum.
Mm-hmm.
Yeah, I agree. And I am a learner. And one of the things I've learned is our head is connected to our body. And so our mental health is integrally linked to our physical health and our social health. So I try to subscribe to the WHO definition of health in general and apply it to mental health. And that's that health is the complete state of physical, mental, and social well-being, and not merely absence of disease or infirmary. So, and really love Justin's analogy of we're on a continuum, and at any given day, we fall in a different place on that continuum, and it's okay. And there's things we can do to help move us along or to celebrate where we are.
And pretty much echo everything that's been said. And the only thing I'd probably say as well is mental health is something that we all have. And it can be compromised by multiple things going on in our lives, whether that be biology, social conditions, pandemics, economic conditions, schooling, homeschooling, you know, at a time when you're trying to work. I mean, there's so many stresses that can compromise our mental health. And so how do we just, and it's okay. And so how do we recognize that connectedness, and how do we sort of reach out and seek the right supports and talk to people? And, you know, again, the more we can talk about it, the less it becomes taboo. And so really being able to do this without blame and recognizing we all have mental health.
Absolutely. You know, I want to touch on something, Lorez, that you mentioned earlier that you guys focus on, and that's that cultural appropriate care. And I bring this up because I'm curious also, you know, we see that it's so important right now to focus on mental health during this health pandemic, but also there's, if you will, a racial pandemic going on as well. And healing right now is incredibly important. So I'm wondering, Lorez, and even Kelly and Justin, if you have more to add to this, but talk a little bit more about that cultural appropriate care and maybe what you guys are seeing in the community, what resources you might have to lend to this idea that we've got to be, it's not one size fits all, like you said earlier, Lorez.
Yeah, so I mean, again, I think if you look at what we funded in alternatives to jail, 60% of the organizations were run by people of color, because we also recognize you know, our jails and prisons are occupied disproportionately by people of color. And so how do we recognize that people define their community? And again, sometimes that's on race and ethnicity, sometimes it's on many different factors. And so how do we create this idea of many sizes fits all? There's not one solution for people to mental health and recovery. Justin is doing a great job of using volunteerism as a way to address mental health and substance misuse needs. That's going to work for some. Some it's going to be maybe storytelling. Some it might be, you know, I need to be in a place with peers like me. And so recognizing that recovery is a journey and it's lifelong. How do we have, you know, those different sizes and different fits? We know, you know, again, with some of the issues going on, the issues within the Black community and communities of color related to the disparate impact of COVID, as well as the current trauma, historical trauma that has been felt. How do we also support spaces and places where they feel comfortable getting that care and talking about those issues? And so again, I think we're really letting community define culture and recognizing also we need to bring in some of the cultural traditions. We worked a lot with sort of the tribal communities when we were first starting too, to talk about a lot of their cultural heritage has been left behind, and they really wanted and needed to bring some of that into healing. And so again, letting communities define what's important for them, whoever they are and however they come together, and making sure their identity is part of their healing.
Very important statement. Their identity is part of their healing. I appreciate that. Kelly or Justin, anything to add? If not, Kelly, please.
Yeah, I mean, I would echo what Lorez said. I think it's also as we think about the pandemic and what that's doing around mental health, there's a social isolation. If you are prone to anxiety or depression, that gets exacerbated. But I think police brutality, watching people being murdered at the hands of police, the racial injustice, I think we're starting to recognize and talk about the trauma that Black individuals in our community feel as they see these events, and they've been compounded year over year. And so I think there's a recognition of the toll that this is taking on our community members who are Black. And I think that there are programs that are recognizing this and working to find ways to offer the most culturally appropriate care, whether it's one instance that sort of triggers the need for care or just an ongoing compounding of instances that has led someone to want to get some help.
That's great. I'm glad to hear those are out there, and we should be paying attention to those. Justin, do you have anything to add?
No, I think it was really well said. I think, to Kelly's point earlier about continuing to try to learn. So we started building this pre-COVID, but we built call it our Kind Council. It's members of our community, people that have volunteered with us. And so we go to them monthly and we talk about the issues that are happening. And we talk about, how our programming is it accessible to them? Is it accessible enough? So we have a very diverse group of folks that advise us on a monthly basis, not our board members, not voting board members, not, community members that are giving us feedback. So I think those needs are continuing to change. I think obviously with everything that's going on, that the needs continue to change and evolve. And I would say that the willingness to be responsive to that is vital to continuing to shift programming in a way that's going to reach people where they are.
Again, that's going back to that. Oh, go ahead, Kelly.
I was just going to put a plug for I'm Unique, one of the innovators that Justin's working on that I think does a really good job of looking at mental health care through through a human rights lens. And I'll plug that in the chat so people can access that if they're interested.
Please do. Thank you. Wonderful. Zachary, you've got a question in the chat feature. Would you like to unmute and ask your question out loud, please?
Sure. Yeah, thanks. And I'm on the board for the American Foundation for Suicide Prevention here in Colorado. And so I work with, and probably people on this call know and have interacted with our director here in Colorado, Sherry Cole. And she's an absolute beast. And I just want to, just first say thank you for, because this is as we say at AFSP, a lot of times it takes a village. And so, thanks for all that you guys do, because we really have a shared responsibility for a shared community to help those, have support, and especially this year. So just want to say hats off to you guys, and just, thank you for your, collaboration, because it takes a lot. My question was more so, the veteran community is one that, historically has always been at higher risk, just because there's this kind of higher risk factors, trauma, things that they are, somewhat unique, that they deal with when they come back. And I personally have worked with a lot of chaplains at, military bases. And one of the biggest things is they already have a feeling of isolation when they leave the service, because they come back and they've lost their sense of community with their fellow, kind of servicemen and women. And so I guess if you could just speak to some of the interactions and some of the feedback that you've gotten with some efforts that are being worked on, or just some of the things that are happening to support veterans. Thank
you, Zachary, for that. Lorez, you unmuted. It's yours.
No, I did. It wasn't really a race. It was to start to say we probably, there probably isn't enough. And I'll say probably, we know also a lot of our veterans come back and they're unhoused. So we've been doing and supporting a couple of programs that just try to get people connected to services, whether it's through some of the homeless serving organizations, but we've also funded some programs, STAR, which is modeled after a Eugene program that sends, when somebody's in crisis, 911 dispatches, an EMT basic or a paramedic with a mental health professional without police or fire presence, just to sort of connect with folks, manage that crisis, and then get them connected to care. And I will say there are a fair amount of veterans that make up some of that population, as well as in our co-responder program. So the city has funded that. It's where a mental health professional rides along with a police officer. We've doubled the amount of mental health professionals and then added 10 case managers. So again, it's not just a one touch, but how do we sort of provide those additional services? But then, you know, again, and I think we have this intersectionality as individuals. And so we probably haven't supported yet. And again, I welcome this as an opportunity as we hear about more programs in Denver, you know, a veteran serving program specifically, but more that intersectionality as we are addressing, we've made some investments in the Black community to address trauma, as Kelly talked about, have made investments to get people connected to care, and, you know, depending on how they show up as well.
Kelly or Justin? Kelly, I saw you added something in the chat.
So comeback yoga, while I don't think it speaks directly to providing treatment services for mental health, it certainly is good to help manage stress and to build community for veterans. It's a free yoga program offered all around the metro area. And then I just wanted to also note that the state recently launched a veterans behavioral health program. So I think the state is also doing some work to promote and support veterans. And then on the Anschutz campus, the Depression Center has some programming around veterans.
I think I would add, and Kelly alluded to this earlier, to your point, Zach, I think the sort of lack of connection or the sense of isolation that veterans feel when they are reintegrating after leaving the military. We've worked really closely with the VA as well as the Depression Center that Kelly mentioned, and a number of other organizations, because we've seen that not only in veterans, but in the people that we serve. And I think part of the reason that our work appeals to folks is that you get that sense of connection and purpose through getting involved in the community. So we've worked really closely with a lot of those organizations to, you know, create avenues in existing veteran services, right? How do we transition people or make, you know, additional programming available to people as they're seeking other care, right? And so I think it's a collaboration question of, you know, how do we create these mechanisms for veterans that as they go to the VA or as they go to the Depression Center, that they can understand, here's the other things that are available to you. Just getting resources out there is really a big, big part of that.
Again, going to where they are. So that's helpful to hear. So in the chat feature, there's another question, and Jorge, I believe it is, you have a question. If you want to unmute, and this has come up from, it looks like several others, but Jorge, the mic is yours.
Yeah, totally. First thing first, you know, hi to everyone. First thing first, I love it. Great presentation, great talk. You know, the question that I have for the panel, you know, as a leader, I work in the banking industry. And, you know, of course, we have deadlines to do. With COVID-19 right now, you know, the team is going through change. And just the full environment of what we do is changing, right? So as a leader, the question that I have for you guys is, how can I support my team with mental wellness at work? What ideas or thoughts that you guys might have so I can make an impact and help my team be better, you know?
Wonderful question. And a lot of folks on this call seem interested. Justin, you're still unmuted.
I know, I just left myself unmuted because I wanted to answer his question so badly.
Good.
I think that, so we actually early on in our existence, we were fortunate to start working with a number of companies of all sizes around this specific topic. And I would say, if you think about the things that Kelly and Lorez have said about community and giving people options on how they get help, you have to look at your employees as we look at the community as providing programming, right? You can't, there is not a one-size-fits-all solution, and that is very true of your employees. So I think giving them the space, giving them resources that they can access in a way that makes sense to them, right? In a way that is in line with their culture, their values, their needs. Because I think one of the biggest mistakes we see companies make is that sort of like, hey, here's our mental health solution. This is it. This is the one thing, right? And that doesn't work. And it wouldn't work in the community. It wouldn't work for us as a program provider in the community, and it doesn't work for companies, period. We've had a great deal of success recently. We actually invested quite a bit in building a curriculum, completely free, completely anonymous curriculum that both teaches managers how to listen when people want to talk about mental health, but also teaching people how to be able to tell their story. And what we've seen with the people we serve is there's this pretty significant gap between stigma reduction and making someone sort of comfortable with the fact that, okay, I can tell my story, and then getting them to, how do I actually tell my story, right? There's a gap there. So we actually built a free, and I'll put the link in the chat, we built a completely free, anonymous online curriculum that you can share with your employees. And it just gives them tools to be able to talk about their experience as it pertains to mental health. So yeah, I think, again, the point of giving people resources that are varied and align with what their values are, I think, is the most important thing.
Yeah, I think Justin's absolutely right. And I would just add, normalizing it. So one of the things we do, it's really, really simple. Before we start every meeting, we do a check-in, like, how are you guys showing up today? Is anyone having a bad day? You need us to give you a little wider berth around things, or is anyone really, really excited and you want us to celebrate with you? And no one has to share, but it gives them the opportunity to share if they want to. We also had a staff member who said, what if we started all of our all-staff meetings with 2 minutes of meditation? So that's what we do, 2 minutes. She puts on a little video. We just all breathe for 2 minutes, and then we get started. We also love Justin, Project Helping, and Kind Hub. And so he has Kind Kits that you can do so that you can give back to the community. And we had a community space, which is closed now because of COVID, but we have a kiosk of Kind Kits that are available to our staff and to our community members, that when they have a little downtime and they want to give back, they can give back, and that's how they do it. And then the only other technical thing I will offer is most of us have EAPs, and they are widely underutilized. And so making sure your staff know about EAPs, but also talking to your EAP provider to talk about what sorts of providers they use. Do they reflect your staff? Would they be people your staff might be comfortable talking to? And really pushing them to make sure that you're purchasing their services, that they're offering services that are going to reflect your employees, and that your employees are going to feel comfortable taking advantage of.
There was I'm sorry, one more. There was just a clarifying question in the chat. What's an EAP?
I was going to say it's an employee assistance program. I hate your. I'm like, oh, does everybody know what that is?
I'm so sorry.
We all speak in acronyms all the time.
My apologies. I shouldn't have done that. Sorry.
No, it's all good. It's, I think just the other thing, just to be cognizant of, letting people approach and share, but not everybody's going to be comfortable sharing in their workplace. There's a certain vulnerability in that. And so just recognizing that's okay. That's where these employee assistance programs can be super helpful. It's like, how do you create the space, but just recognize not everybody's going to take advantage of that. And what are some of the other spaces? Because again, in the past, people have been afraid to share any health needs in the office and workplace. But recognizing we're also in a different time where we are facing a lot of isolation. How do we connect? How do we give that space and place to folks to say, are you doing okay? And really listening, asking that question in a way where you're giving that time for somebody really to answer meaningfully. I think even that can just be helpful. Even if people aren't willing to yet open up about maybe their mental health or substance misuse needs in a workplace. So just, recognizing there's also a certain fear many people have about sharing at the workplace.
So I want to keep that conversation going a little bit. Jorge, did that get your answers that you were looking for before I?
Oh yeah, 100%. I wanted to thank all of you guys. Great responses. I appreciate it.
Awesome. I want to come back to this idea of this conversation is taboo. It's a stigma that we want to get rid of. We've talked a lot about it on this conversation. I wonder if there are any more kind of practical examples that you guys can talk about that could help our audience understand how we can start reducing that stigma and what we shouldn't say. Kelly, you mentioned, refrain from saying crazy or insane when talking about somebody that you don't like. Are there other practical examples that we can use in our everyday to help us reduce that stigma?
Well, I think that, so again, we're very fortunate that we've gotten to work with a lot of companies on this topic. And I think we parallel this conversation again, like I mentioned earlier, a lot of times with physical wellness. You would not just have health insurance and call that a wellness program, right? You have STEPS challenges, healthy eating challenges, all these proactive things that are working on people's mental or their physical well-being. And I think it's important that we take that same approach with mental well-being in the workplace, right? So we say a lot of times starting small and just using, this sounds super simple, but using the word because. So Kelly mentioned they're going to start their meetings with 2 minutes of meditation, right? So if you start your meeting by saying, hey, we're going to have 2 minutes of meditation, great. What if you said, we're going to have 2 minutes of meditation because it's good for our mental well-being? So you can start planting those seeds and having those conversations in a way that's really non-threatening and inclusive, saying, look, we all have mental health, mental well-being. We're all going to move up and down this continuum from time to time. So let's start addressing it in that way, that we all have this, we can all work on it together. And here are some simple ways, whether that be, let's go for a walk because it's good for our mental wellness, or let's volunteer together because it's good for our mental wellness. So those are some small things that we talk about with companies a lot of times, just to start to slowly build that conversation to be a more regular thing.
Love it. Lorez?
The other thing we've been trying to do more and more of, I talked about art being a focus of this funding area, because I think, again, sometimes it might be hard to come up with the words, but how do you use art of all forms to really be able to express, what you're feeling or what you need? And, storytelling was a big part of our campaign. It was all about people that had challenges or struggles. Even Representative Leslie Herod, who is one of the sort of authors of Caring for Denver, talked about her own story with her sister in and out of experiencing trauma, not able to get the right care. So then she started misusing substances and is in and out of corrections, and really never had an opportunity, opportunities to engage in care that worked for her. But in all of these stories, they're very strength-based. It is a piece of who they are. And as they're coming to recovery, or as they're looking for solutions, how do we never define somebody solely by a mental health or substance misuse need? We're all much bigger and more complex than that. But it was through that storytelling, everybody, and that's why I'll say I think we got 70% of the support, is everybody could see themselves in one of those stories. They could see their family member, they could see their community, their youth, and that's why they knew needed to do better. So the more we can do, I think, storytelling and ways to, as Justin said, normalize it. Well, and Kelly, how do we normalize it? How do we sort of put it out there more and not have it be, it's somehow a bad thing, but it's just part of who we are, and it's part of our recovery, part of our journey in life. And that we're able to find we're able to find the care we need to be successful.
Love it. Thank you.
Only thing I would add is starting young. So with my two daughters, we do a well child visit every year. And I recognize I'm speaking from privilege in the sense that we have insurance, we can afford a well child visit. So, but I think the other thing I've done with them is we do a mental health well visit every year. And so sort of promoting that our mental health is just as important as our physical health. And we're just going to go to this visit, and it's your opportunity to talk. If you want to go again, we can go again. If you don't have to. And that way it's something that's part of your routine. And so should we get to the point where one of my daughters needs help, I hope they feel comfortable and this feels normalized enough to them that it's not a big deal to say they need to see Dr. So-and-so to get that help. So I think just sort of thinking of it like our physical health and doing the same things to take care of our mental health as we do with our physical health.
Very helpful. Before we start to close out, Chelsea, I see your question in there, and I'm hoping we're kind of running low on time, but I'm hoping that you got some of the answers you needed from that last question. I think we kind of hit on some of that, and just making sure we have these conversations with leadership and provide them the tools that have been shared here today. So hopefully you got that. I want to ask the question that we always ask at the end, and all three of you have already given a lot of this, but I want to make sure we ask again is, what can we do? What can this leadership community do to help?
I'll come out first.
There you go. Perfect. Please.
Yeah. I'm going to be, it's a little bit selfish, but I think it's selfish in an altruistic sense. So at Community First Foundation, we have a platform called Colorado Gives. Colorado Gives, you may have heard of because we use that platform for Colorado Gives Day. One of the things that research is demonstrating, and Justin can speak to this based on his work with Project Helping and how he got started, is when we give, it has a positive effect on our mental well-being. But it doesn't stop there. When my mental well-being is better, it improves the mental well-being of those immediately surrounding me. So giving is good for our community. We have Colorado Gives Day coming up this December 8th. We would love for you to work with us to promote Colorado Gives Day and to promote giving, to make us all feel better and drastically improve our immediate surroundings. So that's one thing specific that you can do, and would love to talk to you about how we do that.
The joy of giving. It's very real. I agree. Justin or Lorez? Justin's up first. Here we go.
I guess. I think I kind of alluded to this just a moment ago. I think it's being proactive in working on your mental health. Don't wait until you need, just like you wouldn't hopefully with your physical health, don't wait till you need to go to the hospital. Start working on it now, and also invite people to do that with you, right? So I think that's really easy when we see it all the time. People get invited to volunteer in our programming by a friend or a family member or someone close to them. And inviting them with the clear context that, hey, I do this thing. I go do whatever, in our context, volunteer, and I do that because it's good for my mental health. You want to go. You want to go with me. And I think that starts to normalize that conversation. And, it's a very soft point of entry to say, hey, do you want to do this thing with me? So I would say be proactive and invite other people to do the same.
Perfect.
And, probably what I would add is one, especially as you, I'm going to assume most of you are on here because you have a deep interest in mental health and substance misuse, and you guys shared some of those reasons. And so how do you build your toolbox? So there is mental health first aid or other tools where it can help you better recognize it in yourself and your colleagues. And there's many different types of tools just so that we can be more supportive to others. And then I'd say help, Caring for Denver Foundation is new. We just sort of started giving away money this year, and really want, while we had sort of large support, we want community to know about us. We are a community resource. And so as people are having good ideas, we want to be risk takers and innovators. So how do we create sort of innovative new solutions and support solutions that are working? Like, again, it's not always about new, but we know we haven't done a good job with engaging people with substance misuse and mental health, and we haven't created those many access points. We haven't created things that are maybe as culturally appropriate as they need to be. So how do we sort of get sort of knowledge of what do we want to build? It's one of these spaces where I think, I say this a lot, and I'm probably going to offend somebody, so I apologize for this. I worked in healthcare for a long, long time, in 2 governors' office, and I helped implement the Affordable Care Act and many different things. And there's just some institutional structures built into the delivery of healthcare that don't quite exist in mental health and substance misuse because we don't have a lot, and it's not well funded, and people have huge vested interests. So we have this opportunity to really innovate and do things differently. Whether that's things like STAR and how do we send out alternative responses, to how do we just look at the issue differently and really think about what we're doing. So I think it's also being thought partners with us. Let's think about how we reimagine and do this differently in a way that we build something that we would want to use.
I love it. I don't usually do this, but I have one to add, actually, and it's only because I experienced this last year. We had an alumni program called Escape Your Echo Chamber that focused on mental health. And one of the things that I learned from there that I actually participated in was the Mental Health Center of Denver has a mental health first aid class. And I'm not sure how they're doing it in a virtual world right now, but it was really insightful. I think it was just a wonderful thing. And they suggest it for anybody to take, whether you have a direct connection to somebody with mental health or not, if you have kids, if you're in a workspace. It just gives you a lot of helpful hints on how to listen, what to listen for, and how to talk about mental health and mental wellness. So I add that to the pot there. And I would like to finish by saying thank you so much, Justin, Kelly, Lorez. This was really insightful. I think on behalf of the audience, we really appreciate everything you brought to the table, your vulnerability, your information, your resources. Really appreciate it. And we will send out a recap to everybody afterwards. I want to remind you of a few other virtual voices we have coming up. We have one on September 24th that is going to focus on talking about race with our students, with our youth, with our kids. So talking to our kids about race. We also have one coming up on October 8th, there they are, about voting, the importance of voting, how we get the vote out, what this means. We've got some wonderful speakers that will be joining us for that. So we hope that you will join us for future virtual voices. Again, thank you so much, Justin, Kelly, Lorez. We appreciate your time and all that you're doing for the community in this really important area. Thank you all, and we'll see you at the next Virtual Voices.